I'm a dentist. I really like being a dentist. I love being a dentist. Dentistry is my passion.
Indeed, indeed. It is seen on you. And I believe the people that follow you have also witnessed that you're really passionate about dentistry. And we are glad that we have people like you in this country who do what they do out of passion. And you know, with passion, you can always do a lot of things because you are not limited. But just to talk about dental diseases, I know we have a lot. Some people are already victims. They have gone to dentists. They have. People have a name they call you, abakuze b'amannyo. I don't know whether you feel proud when someone calls you Muko.
We are not proud of that name. We just say it is a miss. That's why we want to do it. Cancel it out.
To demystify it, okay? Yes. But I mean, very many people have visited dentists, and when they visit dentists, they, of course, they tell them a lot of things. And not forgetting that when we come back to our people, they also get some underground unresearched information that they mix up together, and they end up getting issues, and a lot of issues.
Yeah, of course.
That is really unfortunate. But we are here to discuss this. And when we talk about the common dental diseases, maybe if you can talk about the prevalence of these diseases, and what are some of these prevalent diseases, dental diseases?
Okay, thank you once again. Yeah. It's a pleasure to be here on Family TV, to be teaching the nation, to be teaching Uganda on some of the common dental diseases and usually their preventive measures.
Yes, yes.
Of course, as you have elaborated, that dentistry, more so the dental diseases are common, you know, and the mere fact that dentists have the dental to patient ratio, dentist to patient ratio is very few.
Hey.
Yes, dentists are very few in the whole country. You know, if you compare them to other, you know, other medical personnel, we have very few dentists. Yeah, so you will find that some people, for example, in far regions of Uganda, will not access dentists. Even when they have money, even when they have resources, they are not going to get access to dentists. So we as Oral Health Schools Uganda, that's why we came up with some programs like this of trying to sensitize the nation. You know, when you get the information and utilize the information that you have really got, it can enrich you. It can help you avoid, or you know, these some of the common diseases that affect our teeth. So, given an opportunity, I want to first of all elaborate some of the common dental problems, so the dental disorders that are common, and then we shall talk about their signs, their prevalence rates, you know, and then as we are ending, we shall give their what?
Exactly, the preventive measures.
Yes. Sir.
So we start with the prevalent diseases, that are so common in our society.
So research has shown that when we say research, statistics, of course, they're always verified from the WHO, the World Health Organization. It has shown that we have a lot of dental problems, but most commonly we have tooth decay. Tooth decay, you know. Tooth decay is what we call dental caries, you know, or having teeth with holes, you know. Yeah, that is tooth decay. That is the most common dental problem that people are facing nowadays, both in cities and villages. Then we can also talk about sensitive teeth or sensitivity, feeling that kind of mild discomfort, you know. Then we can talk about people having, you know, we call it dental plaque, or having dirty teeth. Yeah, people's teeth are turning from white to some other colors. You see, so those are some of the also the common the common problems. You know? Then we can also talk about people having, of course, they have broken teeth. People's teeth are breaking now and then. They are wondering which type of toothpaste they can use. They are not sure. You see, people when we talk about dental, someone outside there should not think about a tooth. Actually, we just abbreviate it as oral health. You know, oral health tries to mean anything that is in the mouth, where we shall take the tongue, you know, the teeth, the soft tissues like the gum, you know what? So people have gotten issues with their gum, bleeding gums, you see? Yes, people have gotten ulcerations or small wounds. They imagine, they wonder what could be the exact cause and then what is the solution to such problems, you see? So those are some of the common issues that we have. Then also, people have an issue of bad breath. People have issues with bad breath, or what we can just call halitosis. They brush, they have tried to do that, and
they tell us, brush the tongue, you try, but still.
Yes, but still, you know, their scent from the mouth remains unpleasant, you see. So those are some of the common, you know, dental problems that we are going to talk about tonight.
Okay.
And if time allows, we shall elaborate more some of the signs, symptoms, how can we avoid them, so that a person watching us from far, where you cannot access a dentist, can really do those measures to avoid those problems. Yes.
I think we start with the most common one.
The most common one.
Yes, and those are dental caries.
So, you know,
because you realize that even the research we are seeing shows that 80% of the children in Uganda have tooth decays, and this must be a very worrying one, because you also started with it and you said this is the commonest.
So now, dental caries, as I have told you, that tooth decay, first of all, it is a microbial disease. It is a disease that is caused by germs. You know, you shouldn't worry where those germs come from. We are humans, we are living creatures. We have germs, you know. We have those microorganisms.
Even when we try to wash our hands, to mind what we eat, we still get in
We
germs.
still have those germs. Actually, when we try to talk about some of the common causes or the causes of tooth decay, we shall say that there are only 4 factors. One, the major ones, you know. One, we shall say that the microorganisms or the germs, which we have in the mouth, which we have in our body. Every living creature, we believe that it has those microorganisms. For example, if you have ever slept, you know, and then woken up very early in the morning, even if you brushed, but you will feel, you know, your mouth is unpleasant. You know, you feel the saliva that is there, it is kind of sticky and unpleasant. Yes, because all that night, microorganisms or the germs were just moving around. So those germs, we are just, we want to put it in simple English, so that an outside person there watching us can understand. Even someone who never went to school can understand these things. I don't want to use medical terms here because they are going to confuse us the more.
True.
You see? So we have those germs or the microorganisms. I usually tell my people that if we get any creature, be it a goat or even if it is a human being, and we press them in a very clean press, you know, and you just give a few days, like 3 to 4, you just find maggots moving. Just assuming you have pressed a dead person or a dead creature in a certain clean room where there are no germs. Won't you find maggots moving after like 1 week?
Of course.
Yes. Where do you think those maggots will have come from? I'm just now asking. But, you know, so we have those creatures or those microorganisms within us. So in the mouth, they exist as normal flora. Normal flora. The reason why we tell people to brush, we want to render some of them useless. Yes? We want to render some of their activities useless so that they are not active. So I was telling you that tooth decay is a microbial disease, or it is a disease that is caused by germs, of which those germs are found in our mouth. You see? Now that tooth decay, it majorly affects children's teeth. However much, it also affects we adults. Okay. You know? Statistics have shown that 60% of tooth decay affects children's teeth. And then the remaining 40 will be affecting what? The remaining 40 will be affecting the adult's teeth. Then also, statistics have went ahead to show that on that 40% within the adults, it affects more in ladies than with the gentlemen. Yes.
Why?
I will tell you the reasons why as we are moving on. So, why dental caries or tooth decay is common in children's teeth is because children, the teeth or milk teeth, you know, children's teeth are called milk teeth or primary teeth. They are not fully hardened. They are not fully calcified. That's what we can just say. They have a few or very little minerals if we compare them to our permanent teeth. As you know that they want to, you know, they are just paving a way and they all want to come out, you see. So they are not fully calcified or they are not fully hardened. So like I can tell you, you know, we are just starting a topic in the middle, but tooth decay is something broad, you know. So tooth decay, first of all, is caused by major 4 factors, like I can elaborate. One, I told you that is caused by microorganisms.
Yes.
Secondly, our teeth themselves. Because a decay, it is not going to be formed on the tongue, it is not going to be formed on the gum, it is not going to be formed anywhere, but on the tooth itself, you know. So we have now 2 factors, right? A tooth itself
and the
microorganisms. Now, the third point is food. You know, why don't you hear some people say sugars cause cavities, what? Now we are on the third point, food. I will also show you how this food cause and which foods cause cavities in our teeth. Those are now 3 factors.
Yes.
I think any person watching us can now really understand.
Yeah.
It is just simple English. And then the first point is time. Yes. The first point is time.
How is time now related to these things?
Now we are going to break down our 4 points to come up with a cavity or your tooth.
Exactly.
Even if we just explain that process, we are good to go.
Okay.
Yes.
I'm already excited to see how time is interlinked with all these. So you were actually breaking down the microorganisms, and then we went back to listing these. But I think we can now in-depthly discuss these factors.
Okay, thank you once again. I want to begin with the tooth. Since each and everything now is going to be formed on
the teeth.
One, if, for example, people who have malaligned teeth, you know malalignment? People who have many teeth like supernumerary teeth, people who have, you know, teeth that are not in proper positions.
Zigzag in the mouth.
Yes, zigzag, you know, teeth that are positioned over the other. Those teeth create more spaces or hiding places for food, or they retain more food particles to the extent that even if this person is brushing, he or she will not finish or will not properly clean all the remains, all the food debris of his or her teeth. Now that is we are on a tooth.
Someone would say that for me, I use a stick. Our friends who still use those traditional archaic methods will say, for me, I use the teeth to remove everything.
Okay, we are now going. We are now moving. So we are on a tooth.
Yes,
we've said teeth which are malaligned. They retain more food particles, more food debris, which makes it difficult for an individual to fully clean. So now they provide what? The bacteria or the germs with what to feed on. Also, on our teeth, for example, the molars. You know the molars? The behind teeth. They have more grooves. They have more structures. The grooves, you know, the pits, the fissures. So unlike these anteriors or the front teeth, which are just smooth and they have no hiding places, or they don't retain more food particles, if we just compare them to the behind teeth. Meaning that behind teeth or these posterior teeth, they retain more food particles and so are prone to dental caries or to tooth decay. You see? So when these bacteria that I told you, all the germs in our mouth, for them, they don't feed on any other thing apart from the debris. They don't feed on any other thing apart from the food debris that remain in your teeth. That is why we tell you, brush every time, brush 3 times daily. At the point thinking, mister.
Yes, it is. It is.
Because they are interconnected. Once you miss one, you will not understand the whole process.
I'm actually following closely.
Okay. That's very nice. Interesting. So I told you that we have a tooth.
Yes.
And now the food debris, I told you we have food. Of course, every time, each and every, even from here, we might get something else.
Exactly.
So we have talked about a tooth and then the food particles.
Yes.
So I am going ahead to tell you that the bacteria or the microorganisms or the germs which are found naturally in our mouth and in our body do not majorly feed on any other thing apart from the food debris. So for them, after feeding on that food debris, after getting what they wanted, now the remains becomes acid.
How? And why does it become acid? Yet I ate my food and it was food.
Now,
which was nutritious.
It was food, it was nutritious. But recall, these bacteria have fermented it. You see, they have fermented it. For them, they don't just feed like we feed. You see, they have fermented it. For them, you know, they feed in, some of them feed anaerobically, and others they don't use oxygen in their feeding process. So in their process of feeding or fermenting, the remains, as they are picking their food, it becomes acids. So it is now these acids that burns our teeth. It is these acids that continuously burns our teeth to form a cavity, to form a hole on your teeth, Mr. Empress. Are you with me, sir?
I'm with you.
So, as I told you that, these posterior teeth, or the behind teeth, they retain more food. Meaning that more acids is going to be formed in the behind teeth compared to these front teeth. So that's why many people come complaining of cavities or holes in the behind teeth. You see?
It is very rare to find someone crying over toothache.
You see?
With this one.
Yes. So that is the point behind. That is why we experience cavities or holes on our teeth in the behind teeth or in the posterior teeth. So we have not finished the process. We are remaining with time.
With time. And that is now where my interest is. I want to see the interlink.
Sorry to take you back on the foods.
Yes.
Now, in our foods, we have termed some of the foods as cariogenic and then non-cariogenic. When we say cariogenic, we are meaning foods which are more prone, or which causes more, which are going to be easily fermented to cause these acids. These sugary food products, when we say sugary food products, we can also, each and every food that you try to eat has sugars, you know, but of course we can classify it into 2 sugars. We have natural sugars and then the artificial sugars. Natural sugars are these sugars that we get from the God-made foods, the natural foods, banana, cassava, posho, you know. In such foods we get natural sugars. So those natural sugars, it is to a lesser extent, they cause cavities. On the other hand, the artificial sugars, which we also call the extrinsic sugars, these are sugars that are in the man-made, or these are the processed food products. You can mention some of the processed food products.
I don't want to
for example,
I don't want to mention brands because I might get into issues with that.
No, Mr. Edris. Okay. So we have the yogurt, the biscuits, the ghee, these chocolates, and each and every, you know, these processed foods.
The ones that we love
It is what we love most. Yes. That is why your seed carries or 2CDK is also in a high rate. Actually, if you make analysis, you'll find that 2CDK is more common in town than in villages. Yet people in villages don't brush. Yet people in villages don't use you see traditional because methods. In town we mostly feed on these man-made foods. We are trying to feed on processed foodstuffs compared to the other one in the villages that are feeding on the natural food products, which are just less curious, or which to a lesser extent causes cavities. Okay.
Now we were still talking about time.
Now. Yes. Now on the issue, let me hope you have understood the point of foods and the others.
It has fully sunk into my mind.
Okay. Now the issue of time, I'm also going to well explain. One, in the whole body, Mr. Idris. Yes. If you are to be asked, what is the hardest part? What is the strongest part of the body? Which answer would you give?
Jonan is whispering into my ears that it is said, but let's take a short commercial break. When we return, probably we shall have gathered the answer. So you also ask yourself, when we come back, you'll tell us your answer and we shall know whether what you think is what the correct answer is. Stick with us.
Family TV, enriching lives.
When you are in the Lord, when you are sealed in the Lord, the devil looks at you and you are glittering. The devil locates a crown. For any person that the devil locates with a crown, the devil will never eat them because they belong to the Most High.
Friends, don't you give up in any form of hardship. Don't you give up, for Jesus encourages us and says, even at the point of losing your life, for the sake of Christ and the gospel, it is okay.
My dear brothers and sisters, let us remember that God is still reigning on his throne in heaven above. And let us trust in him. Let us rely on him. Let us pray each and every time. Let us not give up on showing ourselves out into the world that the Lord Jesus Christ is still King and he still reigns.
You and I are here to reign on the earth, not to complain, not to grumble, not to play victim, not to quarrel, but to reign on the earth.
I pray, Father, that you will release the fourth man to destroy every fire, to protect your people who are in every furnace and set them free in the name of Jesus.
At just 15 years old, Tasha began cutting herself. At 16, she OD'd for the first time. At 17, she had her first baby, and at 18 years old, her first jail stay. Over the next decade, Tasha was in and out of jail over 30 times. Yet today, because of a miracle, she is free at last.
A man and I had gotten into an altercation where I thought he was going to rob me and take my drugs and money. And then I pulled a gun on him and put it in his face. And I was like, oh my goodness, how did I get to the place where I'm about to take someone's life over drugs and money? This isn't who I am, and this isn't what my life is supposed to be like.
Tasha Hill's father died in prison when she was 7 years old. Her mom's drug addiction left Tasha living with her aunt and uncle, who were devout Christians and leaders in their church.
I loved going to church. I loved being in the house of the Lord. I went to this revival, and it was the first time I felt the power of God drawing me, and I found myself down at the altar praying. I got on fire for God until about 4 14 years old. I got involved with an older guy, and I ended up losing my purity and doing drugs all in the same day.
This is Church of Uganda Family TV, enriching lives.
What is the hardest part on your body? We are back and we welcome you from the break. We are looking at some of the common dental diseases, and most importantly, we are interested in the prevention or the preventive measures, so that we can see how we can be helped. Before the break, Jonan told me that to him, the hardest part of his body, is his head, because at one time it was hit, and the following day he came alive and laughing at those who hit his head. We are back, Nafutari, and before the break we were actually discussing time and how time is actually related to the three other factors that we talked about, that is the microorganisms, the food, and the tooth. So we pick it up from there.
So I had asked you about the hardest part of the body, and of course I expected you to answer.
Because I was also supposed to answer.
Yeah.
Now Jonan has already corrupted my mind. I feel like saying the head like him.
Okay, now to the viewers outside there, the hardest part in our whole body is the tooth.
Yeah.
If you recall properly, in your nursery or primary school, they used to ask that very question. But they used to ask, what is the hardest part of the body? Not specifically a tooth, but the hardest part of the body is the outer part of a tooth, called the enamel. That white, or the outer part, the enamel, is the hardest part of the whole body. You know, most people don't understand this really.
Exactly.
They confuse a tooth to be a bone. You see, they confuse people outside there. Some of them, they usually ask me questions in my inbox. Is the tooth a bone? What are some of the differences between a tooth and a bone? But I also posed some of the questions or answers in form of questions to them. A bone, once broken, can repair itself, or it can regenerate. It can grow back, you know. I hope, Mr. Edris, you have ever seen people whose bones were broken,
yes,
but once they now visit these orthopedic medical doctors, you know, they repair, and the bones now, you know what, regenerate. But a tooth is that part of the body that once broken, once decayed, it can never regenerate on itself. You have to visit a dentist to rebuild it, but for it, it cannot again rebuild or regenerate. So those are some of the differences between a tooth and a bone. Now, a tooth, our teeth, remains the hardest part in the whole body. That is why you're going to order for your muchomo on Christmas, on your ED, or your KFC, and you find some girls and boys or anyone there grinding the chicken and at the same time breaking some of the bones, meaning that the teeth that are breaking the bones are harder
than the bones that are being.
That's the exact answer.
Okay.
So on the issue of time, as I've told you that the tooth is the hardest part in the whole body.
Yes.
The other acids that I explained to you, Mr. Idris, will also take a good time, approximated to be from 2 to 3 years, for a cavity to be formed on your tooth. For example, if you happen to have a decay on this tooth, it will take you a period of 2 to 3 years for you to start feeling pain. But someone can be existing with a cavity, with a hole on his or her tooth, but not feeling pain. You see? Because even that acid, it will really need enough time for it to burn this outer part of a tooth. You see? For the acid or the infection, the germs, to reach on the living part of a tooth. You know the living part of a tooth, which is called the pulp.
Yeah.
You know, it is deep in the deeper layers of a tooth. So that acid will also to penetrate and reach on it. It takes some good time. And before that acid or the infection reaches on the pulp or the living part of a tooth, you will never feel pain. You will never. Many people are just having cavities or holes on their teeth, but they are not feeling pain. They come in clinics, whatever, in outreaches, in schools where we find them. They say, "Musao, this tooth is not painful, please." And you cannot convince someone actually that the tooth is sick before they feel pain. You see? Are you seeing how time is now essential?
Yes.
Yeah. All the factors, all the other three factors, they need a good period of time for a cavity to be formed, because our teeth are the hardest part of the whole body. And so the other acid that will be produced will also take some good time to burn these tooth, to burn the outer layers, to burn the middle layers, until it reaches on the what? On the living part of a tooth that I've told you that it is the pulp and it is the essential part. Yeah.
Now I see how really time is connected, but I would really love to talk about the other common diseases. But I think we shall base our concentration on the decays for today, and probably when you offer us some time next time, we shall see how we elaborate on the others. So, having seen this, are there any signs and symptoms that I look at and then I know that what I'm having is a decay?
Yes, Mr. Idris. Before we go on some of the signs and symptoms of tooth decay, I want to tell people what are some of the other, those were the major causes, the major causes,
yes.
the major 4 factors that are involved in a cavity forming on your tooth. But we also have predisposing factors, you see. Some of the factors that are going to gear up the cavities to be formed on our teeth. For example, the stains. If we have, there's a, kagori, food debris, hardened food debris that have changed the color. You will find a lot of debris or the stains. Tata, they will have hardened. Food over time, food left in our teeth without brushing will harden, will change color and become yellow. So those food particles will also be retaining, they act as retentive features for what? For the other debris, for the food particles that you'll be eating. Meaning that bacteria will now be provided with enough what? Enough food. So a lot of acid is going to be formed. So people always need to visit dentists for cleaning their teeth, to remove those hardened food particles. Secondly, nutrition. People have to watch the food, the kind of diet they are feeding on. We have elaborated that high or the sugary food products or the processed foods are more prone to causing the decay compared to the other natural foods. So have you seen how now the diet is also involved?
Yes.
Now, another thing is the kind of teeth, alignment and whatever. So also people have to watch their teeth. If your teeth are not properly aligned, if your teeth are having a lot of features that can hide food, that can hide, you also need to go and visit the dentist as early as possible. Then people have disorders within themselves. Disorders like, do you know that some people chew cud?
I'm hearing it for the first time.
Some people, they eat food, they have gotten problems with their esophagus. Yeah, they have gotten problems with their esophagus to the extent that after eating, after every meal, food that have already reached in the stomach, it now starts coming in the mouth. And already that food in the stomach is acidic. So once that acidic food now comes back in the mouth, it already acts on each and every teeth. You'll find someone with almost 10 teeth with cavities. We call it rampant decay. So also people are experiencing problems of dry mouth. Mr. Idris, saliva plays a great role in solving most of the common dental problems. So if you are encountering dry mouth is when you don't have enough saliva. Your salivary glands are producing very little saliva. You see this saliva, it washes away the food debris from our teeth. Even if you're not maintaining oral hygiene, the saliva that is produced will keep washing away the debris. So if you have problems with your salivary glands and you have dry mouth, you're likely to be having what? Cavities or holes or tooth decay in your teeth. So those are also some of the predisposing factors. Yes.
Now we get to the symptoms and signs.
Of course, some of the signs and symptoms of tooth decay are visible. For example, Mr. Idris, whenever you wake up very early in the morning and you're taking a shower, taking your breakfast and whatever, you're brushing your teeth. Some people use mirrors actually, dressing mirrors and whatever. So one of the common signs is when you see the black spots. You see? In the biting surfaces of the behind teeth, you will start seeing some of the stains or the spots. As you see, our teeth, God created it with some anatomical sites. So you will find also the decay in its earliest stages. It always looks like stains, dark stains. So those are some of the common signs to watch out. Even if your tooth is not painful, but you're seeing some, discoloration on top, stains, you see, that is a common sign. Then if you can see a cavity, you visibly see a cavity or a hole in your teeth, that is also a sign. If you're feeling that kind of small pain, mild pain when you're eating, it is an indication that you have cavities. If your teeth are sensitive, you're eating something hot or cold, but you're feeling that kind of discomfort, that is sensitivity.
We hear people say, for me, I don't eat cold. I don't take cold things because when I take them, my teeth, they don't know that it is a disease.
They don't know that it is a disease because within those cavities, as you're eating food, now food enters in that cavity and of course it seals it. So you might even not see it. Are you with me, Mr. Idris?
Yes.
You might not see it. But when you're eating and you feel that kind of discomfort, of course, it shows that now debris is entering and it's almost reaching on the living part of a tooth that I told you. Meaning this person has a cavity. You see? Yes. Then also halitosis or bad breath. Bad breath is usually associated from those debris and the remains in our teeth. Of which some of the remains enter properly in those cavities or in those holes. So halitosis or bad breath is also a common sign to watch for if you think you have dental caries or a tooth decay. Then obviously pain, severe pain. When someone has a carious tooth or a grocery, dead tooth, a tooth with a very big hole or a very big cavity, they are going to be feeling pain. Most especially when that cavity has eaten up the upper layers of the tooth, the outer layers of the tooth, and it has now reached on the what? On the pulp. So this person or this patient is going to be feeling pain. So pain is also what?
A sign.
A sign and a symptom of tooth decay.
Okay. Wow, this is serious. And now, after looking at all this, we want to arrest the problem before it is there.
Yes.
Before it reaches that level. What are some of the good oral hygiene practices that people can adopt to see that they prevent tooth decays?
So thank you very much for that question. So some of the preventive measures of this common dental problem, which we also call tooth decay, as I've told you that it is a disease that is caused by germs. So to the clients, to the viewers watching us from far western Uganda, Ibanda, Rukunjiri, elsewhere, Guru, Eris, these are some of your preventive measures. Since we have known that this disease it is microbial rated, it is germ rated. Avoid the other traditional method of introducing drugs from your mouth to the what? To the children's mouth. Do you know that?
Yes, I heard about it. Where a parent puts some herbs into the mouth, they chew them.
They chew. Are you getting how we are finishing ourselves unknowingly, Mr. Idris? So, this parent with cavities, with germs, is introducing the herbs in their mouth, chewing, introducing it with saliva and spitting it in the children's mouth. A children who's safe and whose immunity is still wanting. They don't have enough antibodies to fight with these microorganisms. So they are just giving them dental caries or tooth decay unknowingly, and other diseases, of course. So that is one of the preventive measures.
We should be really very, very serious because you realize that parents think it is okay because this child doesn't have teeth, so maybe their teeth are still weak, so I can chew for them. And not only medicine and herbs and what, but some even do it for food. They grind the food using their teeth and then they...
So, Mr. Idris, that is one of the points to watch for. Parents outside there, please stop this habit. Stop this myth. Because for us, we just call it a myth. They should stop it. Then, some of other common preventive measures is, of course, proper oral hygiene. When we say a proper oral hygiene, we are trying to mean brushing, routine brushing of our teeth.
What is routine brushing? Because some people have told us brush 3 times, brush every after meal. I mean, and sometimes it becomes boring, or sometimes you find yourself in a place where you cannot brush, and so you feel guilty. I'm going against the doctor's directives. I mean,
so Mr. Idris, let me also pose some simple question for you. Why do we brush our teeth?
To remove the food remains.
Thank you very much. So, at what time should someone brush their teeth?
After a meal.
After a meal. Let's assume you have, very early in the morning. When exactly should you? Because you're going to wake up, you have to eat, you have to, you have to take a shower. So, I want to know the exact period when you're going to brush.
Society has made us believe that when you wake up, the first thing you do after prayer is brushing. Although we know it is contrary to what the dentists say.
Okay. So now, most people, actually, this is so amazing and it's very bad at the same time. A lot of people, statistics have shown us that many people brush. Many people have tried to buy a good types of toothpaste on market. Many people have, they have tried to visit their expensive dentist, but they are still suffering from some of the common dental problems. Statistics have, again, went ahead to tell us that it is because these people, they just miss out 2 points. They confuse the 2 points. They brush, but they use wrong techniques of brushing. That is why I came with my model demonstrating your mouth, lower and then upper jaw with their teeth. So I want to show them how we should be brushing. So statistics have shown us that these people are suffering because they brush, but they don't know the right techniques to use. And then they also brush in a long time. So are you seeing the 2 factors?
Yes.
We brush, but using wrong techniques. We brush, but in a wrong time.
Or if you have the right techniques, then you brush at the wrong time.
You see? Those are things that are truly missing in the society.
You brush at the right time, but with the wrong techniques.
With the wrong techniques.
Wow.
So now, someone should wake up very, very early in the morning. You should take a shower, eat your breakfast, and then before you do any other thing, before setting off for your jobs and whatever, the last thing to do must be brushing. After eating your breakfast.
Where did this whole thing come from? Where you're supposed to brush before, as you wake up, that's the first thing you do. I mean, because you realize in the village, days back when my Jaja was still alive, she used to even say, you're not going to take breakfast until you've brushed your teeth. So probably she had also seen the same thing. And
so these are some of the, there is someone today who told me, someone called me from very far from Kabare and was like, you know what, dentist, I have experienced a lot of bleeding gums ever since. I think this is, he mentioned it in Runyankore language that it is efumbi. You know, efumbi in English is allergy.
Yeah.
You see, people have a lot of myth, and you know, these things are real, and people think they are just inherited and whatever. Actually, most of these common dental problems are not inherited. If you do the right thing, then you're going to avoid them. Okay, Mr. Idris, someone should not wake up very early in the morning and brush their teeth first, like most of us do. Most of us are outside there. We wake up very early in the morning. The first thing is look for your toothbrush, you know, toothpaste, and you brush.
What happens to a situation where I don't eat anything at home? For example, I wake up, I bathe, I prepare, come for work, and I only eat at around 10. Does it mean that I don't brush? I just carry my toothbrush and toothpaste as along with me as a
Now, why we encourage brushing very early in the morning after trying to do each and everything that you're doing is we assume you will have slept with some of the debris. So we want you to take them off. We want you to take them off. Then when you reach at your workplace, after eating your lunch, we assume maybe you don't have your tooth, because we really recommend that someone should be brushing 3 times a day. But of course, we know you will not carry your toothbrush here at work. So we advise after eating your lunch, you just rinse. Rinse like 2 times as you're spitting. At least you will have removed these food debris before they harden. Then when you reach home, that is supper. After eating supper, before you enter your bed, now let you brush as your last resort. You will also have removed the food debris from food, of course, that you ate in supper.
We're running out of time. Kindly show us the right way of brushing so that we can also know. So now that you've told us that times, now let us know the right way to do it.
Also, some of the preventive measures is people should be, like I've told you, they should be brushing routinely. That is 2 times a day. They should also be flossing. Flossing is removing the food particles that are in between our teeth. That is what we call flossing.
Every after meal?
Yes.
Do you just assume that now that there should be a particle and then I start flossing?
It must be there. A toothbrush will never enter in the spaces in between our teeth. These spaces are very small compared to the bristles of a toothbrush. It cannot enter even if we are trying it from here. These bristles cannot enter into the spaces between our teeth. That is why we encourage people to not use toothpicks again. Yes, because toothpicks are very big. They are large and you know they are sharp. They are going to cause injuries on your gums, and you know what, breathing, that's where now breathing comes in. But we have here our dental instrument called a dental floss. Now this dental floss, it is made in a way that it will enter into the spaces in between your teeth, and it will be removing each and everything, each and every debris, meaning that you will be left with no food particles for the other bacteria to feed on. That's how you'll be surviving these common diseases.
Should the flossing also be every after meal?
Flossing should be every after meal. Go and look for dental flosses. Dental flosses are found in supermarkets. Dental flosses are found in pharmacies. Dental flosses are found in some of the dental clinics. And they are not expensive. You see, prevention is better than cure. Go and look for them and let you prevent these deadly dental caries. And then you asked me about the right brushing techniques.
The right of brushing.
Now, in the brushing techniques, of course, as we are winding up, I advise people to always change their toothbrush. It is one of the preventive measures, Mr. Idris. Changing your toothbrush every after 3 months is the key also to preventing these deadly dental caries or tooth decay. Because we assume that a toothbrush with its bristles that are very soft and and they are bent cannot do properly its work. Will not be removing the food particles properly as we assume. You see, now always change your toothbrush after 3 months. Now the right brushing techniques are very many, and it depends on whether you're an adult or whether you're a child. You see, but brushing should always begin from the behind teeth. And the good criteria of brushing should be, it depends on the way you're holding your toothbrush. If it is these anterior teeth or the front teeth, you should open your mouth. Opening your mouth, you see? You should open your mouth, and then, are you seeing how I'm holding my toothbrush?
Yes.
Opening your mouth, and then you're going to be brushing like this. As you're taking them out, not just vigorously mixing each and everything like how we do. You're opening the mouth, pressing your toothbrush on your teeth, and almost including on the gum lines. If it is behind teeth, do back and forth strokes, like 4. Back and forth strokes, and then sweep down. Back and forth strokes, and then sweep down. Back and forth strokes, and then sweep down. You're sweeping them down, you're removing the particles, not just mixing them.
Well, I think we can't go beyond this point, but we shall request you to create for us sometime and next time, so that we conclude on this and we elaborate more. Like you said, there are a lot more techniques of brushing. You've only told us half of the one technique, and we want to exhaustively have it, but of course because of time we cannot go beyond this point. Everyone else in Mukalas is my name. I've worked with Jonah Jal and Norman Nkonte. Mulangira webula moju. Do you call, are you Mulangira or there's a Lula Moju word? Well, from the entire team, it is a good night. Next is Soul Moment, but remember there is Good Morning Family tomorrow as you wake up with us. We meet again tomorrow.